Hi, good afternoon. It's Jennifer Shepard with the Shepard Center for Integrative Health. And today what I'd like to discuss with you is brain health. A lot of conversations I've been having recently with consult patients on the phone and with patients in the clinic, we've been discussing headaches, many of the reasons behind the headaches, double vision, possible vascular concerns, hearing issues, vertigo, post-stroke. So with all of these individual diagnoses and symptoms, we start the problem-solving process, right? A lot of these patients have been to multiple providers who have helped them the best they could. Some of them went on to even more advanced testing, rule out some diagnoses such as even leukemia or some advanced neurodegenerative components, which fortunately a lot of those things came back negative, but the patients still are having symptoms and the symptoms are affecting their lives. What I want to talk about is our problem-solving procedure and really what we are looking at to identify the reasons behind these symptoms and what we can do with our hands to help restore the healthy fluid flow. It's going to be a lot of fluid flow today to help ease the body of these tensions and these pressures. So in our we have demonstrations today. So our body is, I don't even have the percentage, but we are made of fluid. We are made of water. I want to go even as far as maybe 60% water. Again, the fluid in our cells, the fluid in our blood, the fluid in our cerebral spinal fluid through our digestive system. So we are fluid-based beings. And the beauty of that, which is a very exciting area for us to start to bring more awareness to, is how when fluid is obstructed in our system, problems arise, problems can ensue. So I'd like to start with the cranium. So here's the bottom of your skull. It's the container, right? So again, we've got a pressure system of the brain, pressure systems throughout the body. And again, anywhere in your body, if the pressure systems are off or if the fluid cannot be adequately exchanged, we start to run into trouble. So particularly when we're getting into headaches, double vision, I start thinking, how is drainage? How is fluid flow coming into? How is the vascularity? How are the tissues able to have that blood flow and that exchange? So as we get into the cranium, as you look in the bottom, there's all of these holes in the base of your skull. So through these holes at the base of your skull is where very important arteries are coming up through, very important veins are coming through, nerves are coming through. So anywhere along these fluid pathways, again, if we've had an old car accident or if we've had a trauma, it can change the ability for the tubes and the structures and the fluid flow to come up and drain out. So then as we go into our amazing brain, again, all of the tissues need to be bathed in that fresh oxygenated blood. It needs to have the ability to drain the old blood and clear out the toxins. And then the cerebral spinal fluid is always flowing, and that further clears out the toxins throughout the brain that we accumulate through the day, that we accumulate through toxins, environment, and even local inflammation. So here's where our work goes into diving into the system. And as we work, again, with the body, again, is it in the brain? Is it in the cranium? Or is it in elsewhere that we need to put the pieces together? And for many of these patients, we are right there in the cranium. Sometimes we're at the base, at the bottom, sometimes we're in the top, sometimes we're in some of the membranous structures. But regardless, the beauty of that is, again, the sensitivity in our hands attracted to the negative charge of the decreased fluid. So we get into the physics of how our hands can feel what's going on in your brain. But we're able to feel and identify, here's an area of the cranium or the brain where we're not getting adequate flow. And then what can we do with our hands to set the system up for that fluid exchange to be better and drain? So think about it. Here's your sweet little brain. And if it's not able to drain, there's going to be a lot of pressure, right? When we are looking for reasons for the headaches, or again, pressure in the eyes. Again, if the brain cannot drain adequately, we're going to get some pressure buildup, and that's going to create some symptoms. So it is a very, very exciting area for us to start to develop more awareness for people who have struggled with, again, double vision issues, hearing issues, headaches, and even going in deeper, it will be another conversation for us, but into neurodegenerative and what we can do with our hands in the identification process. What are the structures involved? What are the impairments that those structures have? What happened to them? Was it old car accident? Was it old head trauma? What was it? And then what do we need to do to enhance that fluid flow, enhance that fluid transport so that the body isn't being subjected to so much pressure or areas of the brain not quite getting the adequate blood that they need for it to do its job adequately. So again, we do consults. I love to do consult calls to talk about symptoms and histories and what people have experienced before we come into a session. And then as we decide, hey, this sounds like we've got a great opportunity to explore some deeper areas within the body and see how we can put together the pieces to help you, then we go ahead and schedule an appointment. Our clinic is in Cleveland, Ohio, Rocky River proper, and we treat patients locally and throughout the country. We are able to accommodate people coming in out of town. We do intensive sessions over a couple days. Again, this is Jennifer Shepard with the Shepard Center for Integrative Health, and thank you for joining.